COVID-19 infections are on the decline, and so are hospitalizations. So is it time to get rid of the national state of disaster, which has again just been extended to the 15th of next month? Now, some people are calling for things to return to normal, but government is still discussing the way forward. Let's get more from Health Minister Dr. Joe Phaahla. Minister, thanks so much for your time. We appreciate it. There are growing calls for us to lift the national state of disaster, but we heard from the Cooperative Governance Minister today saying it has been extended. What's your view?
Well, I would have wished for the state of disaster to be lifted last year if we didn't have a problem, because nobody really would like to live in a restricted environment. But these restrictions and currently, as government, if you have to implement any measures to help manage the spread of a pandemic like this, you do rely on laws and regulations. And currently, the only laws and regulations which were found to be suitable when this pandemic struck last year, there were meetings where there were a lot of discussions as to what can be done, and the Disaster Management Act was found to be the most suitable. It has been discussed in Cabinet and in the Coronavirus Council to find alternatives, especially when the pandemic severity is reducing. So it's something which we are working on, but unfortunately at the current moment, there are a number of avenues we're exploring, because I think we have now gone through almost 2 years of this experience that what you see today, you can't guarantee what will happen in another 4 weeks or 6 weeks. So we have seen just in South Africa itself, but also in other countries, we have seen the same situation. So
Minister,
we're cautiously optimistic in terms of the future, but we can't be reckless as well.
Yeah, so what are the alternatives that can be put in place to actually see us out of a national state of disaster, though?
We are discussing that. We have been tasked as the health department to look at our own health regulations to see which ones would be suitable for certain levels of infection rates. So our legal team is working with the state law advisors. It's also working with the Department of Justice and also lawyers from the Cooperative Governance Department to look at these other alternatives. Because remember, what I don't think any one of us, even as we want to reclaim as much of freedom as we want to, we're not looking forward to a situation where you can have huge mass gatherings where the slightest, if there's somebody infected, asymptomatic, at the end of that, millions or thousands of people can then be infected. But it's just to say that as the infection rate is lower, let's have some more freedom. So that's what we're looking at. So our teams are working on. We will be reporting back to Cabinet and to the Coronavirus Council. We've been given timeframes to come back with proposals. So that's something we're working on, because you know that a government in the form of the COCTA and presidency and even us at health, we have been at various court cases where various bodies have been challenging some of the regulations. So it's not nice, because we want to focus on the core business of each one of the arms of government.
Yeah, and I guess the question of dropping the national state of disaster will continue to be raised, especially with the economy being so hard hit. Is the national state of disaster currently in place only to control the amount of people gathering? Because it seems to be one of the main regulations and restrictions we have in place currently. There's no curfew or anything like that.
That's the main one, because, and then of course, even compulsory wearing of masks in public places, of course, public places of service and so on are required to control the numbers, but also to provide sanitizing and hand washing facilities. But it's largely the issue of gatherings, indoor, outdoor. That's really the main, because we all know that the lessons we have learned is that actually the biggest risk is where people are congregated. That's where the spread happens at a very high rate. So that's really the main one, including, as I've said, the requirements to make sure that in certain settings, people must be screened. Some areas you still have temperature checks, making sure that people have facilities for sanitizing and all that.
All right, last question on this. Given what you're saying, the fact that you're looking for alternatives, do you think, as the Health Minister, that it's time to actually lift the national state of disaster soon?
Well, I think I've answered that by saying where I'm seated and as part of a collective, and I believe that that's the case also with the President, if there would be other, measures which could help, because it's to help the population to provide framework through which, in an orderly fashion, we can assist the South African population to avoid risk. And the state, as you would know, in many other aspects, does have that responsibility. So if we could find other ways, otherwise, if we were to be populistic and reckless, we could say tomorrow that there is no further control. And I can tell you, if there was to be an outbreak somewhere where there's a function held and thousands of people congregated, no proper ventilation, and there is an outbreak, a huge outbreak of COVID-19, people are going to scream again and say, but where is government which is supposed to help us to regulate this situation? Yeah. So I think all of us who are holding this responsibility, if we could find just those flexible methods, we would really very quickly, as early as yesterday, get rid of the disaster management as the tool.
All right, let's move on to vaccines, because it's clear that there's a slow uptake in vaccinations in South Africa. When are we going to get a decision on the mandatory vaccines in this country?
The work is going on, as President announced quite a while ago. There's a committee of director generals and other officials, which is called the Net Joints, which has got a committee which has been working, consulting. It has been to NETLEC, for instance, but it's consulting with various stakeholders. I believe when we do have our next Coronavirus Council and subsequently Cabinet, that team will be ready to give a report which will come with proposals, which firstly the Coronavirus Council must consider, and if they are found to be suitable and sufficient consultation, we know that there will never be a uniform agreement. We know already there are particular groups and institutions which have, like some of your churches, who have a particular anti-mandate position. So we're not looking for full consensus, but we're looking for sufficient consultation to look at in what setting and so on. That report should be coming, I believe, when President calls the next Coronavirus Council. That team should be ready to give a report with specific proposals upon which the Coronavirus Council and subsequently Cabinet and also the President's Coordinating Council, which include premiers and some executive mayors, will then be presented with those proposals, and the decision will finally be taken by National Cabinet.
It's an important decision for us to move forward as a country, isn't it, Minister? So in terms of a time frame, do you think by the end of Feb or March we'll have a final decision on this?
Definitely. As I said, we expect that. I mean, that team has been working for quite some time. I'm informed by our own DG that they do have firm proposals. In fact, I think by next week they will be ready to present to myself, and then so that we can then take it to the full Coronavirus Council and subsequently to this committee of Presidential Coordinating Council and finally to Cabinet. So those will be the steps. I'm quite optimistic that before the end of January, this matter will have been decided and the full consultation will have happened, and the President will be in a position to announce in terms of what decisions. As I said, we're not necessarily, naive that we can have everybody agreeing, but we just want to make sure that there is sufficient consultation.
Yeah. And now let's talk about schools, because it's a big issue for South Africans. We're seeing pupils return to classes this week, still on a rotational basis. I know consultations still ongoing in that regard, but there's a strong call for children to go back to school on a full-time basis. What's your opinion?
Again, that will be, if everything was equal, one would say that we should indeed support the basic Department of Basic Education, its minister and managers to go that route. But they are also cautious because we are fresh in the fourth wave. And this fourth wave, amongst other of its features, when it started early in the middle of November, part of the characteristics of this fourth wave were that there were more children even below the age of 5, and even more of your adolescents, below the age of 12 and below the age of 18. So at the school going, not even university going, there was a lot more of younger people and children who were infected by this Omicron. So we have to move very, very cautiously in that regard. So there is a team which amongst them Professor Glenda Gray, from the president of the Medical Research Council, is part of that team, who are working on a process of advising, looking at the pros and cons, looking at what is safe, what is not safe. And I'm told that in very soon they will be, they're still busy with the work. They will be reporting to myself and to the Minister of Basic Education in terms of what is recommended. But I would urge that we, especially when we come so fresh from an experience where young children were infected in bigger numbers than we have ever seen. Granted, at the same time, we know that even in this Omicron, even though there were bigger numbers, most of them were mild, and very few were actually severe, but there were a few who were actually admitted to hospital. So we just need to give the experts some space for maybe a week or two to come back with an advisory. And then once we get that advisory, we will discuss it with Minister Motshekga, so that we can then be able to provide guidance which is backed by medical science.
Yeah. Just how much time do you need, though? Because we've already started the school year for 2022, and you have parents who are anxious, obviously, and pupils over this issue. So by when, again, would be the question as to when you'll come to a decision on this? Because we already have experts on television and radio saying it is time.
Well, those experts must fit into that team. I must apologize that in terms of the time frames of that team, I can't at this stage speak for them. I'm not sure what are the time frames which had been agreed together with, although they are medical experts, but they also been reporting both to myself but primarily to Minister Motshekga. It's something which one will be able to follow up, but I would rather advise that we give them sufficient space. I would imagine that, again, I don't see them taking beyond January to be able to provide, because the information is really more of just examining data from South Africa, from what we know now over the last 2 years, the changing nature of the variants, its effect on younger people, severity, and so on, whether maybe even if it's no more about a meter or 1.5 meter, what kind of space will be required just to make sure that, because definitely, the kind of classrooms where you find, 100 pupils in a classroom which you take 30 or 40, that's just not very advisable in this environment of the pandemic. But I think what we are looking for is, there's the extreme of congestion, and also the team will probably be able to advise on sufficient safety without paralyzing the school system, but and while avoiding over congestion, which will definitely just be very risky. I'm not really in a position to speak on their behalf, but I would imagine that a job like this on which data in the country and abroad and other countries is there to be analyzed, it shouldn't take beyond the end of January for them to provide sufficient advice.
Yeah. And lastly, we often hear a lot about transitioning from COVID-19 being a pandemic to an endemic disease. Do you think South Africa is ready for this?
I think we have no option. I think I share that view with various experts. I think the Omicron has already shown us that this is probably the way it's going to go. Our experts even earlier on had said to us, we must expect that as the pandemic progresses, it's likely as the mutations carry on, the virus is going to try to survive by mutation of such a nature that is going to be highly transmissible, but it will be because it's getting weaker. So as this, I think we've learned a lot of lessons in terms of this fourth wave and this variant, because initially when they told us the changes, it was very scary, the escape from immunity. But we've seen it. It's been more transmissible even for those who are previously infected, even vaccinated. But basically, we can see the protection of that vaccine and other natural immunity with a milder disease. So one is expecting that going forward, we're going to learn this. I expect that 2022 is going to be a very critical year for us to make those adjustments from moving to pandemic to endemic management of coronavirus.
All right, Minister, thank you so much for your time. Always a pleasure speaking to you. Appreciate it. Dr. Phaahla is the Health Minister in South Africa.